Okay, I will bring the room back as it is 12:15 now, so we can start and get ready for our panel section. But I'll just do a quick recap of what we've covered so far in the session. So we had our keynote speeches from Councillor Hamilton, Dr. Justin Varney, and Sarah Pullen this morning, which gave us from the elected points, from the city leaders' point of view, but also from the operational point of view of leadership as well. We then explored what is the Birmingham Food System Strategy and the key aspects of it, and Rosie and Sarah managed to get that whole section and cover some of the amazing projects and themes into that part. We just had our quick break, and now we are coming back to what I would say was one of the most exciting panels of the 2 days, in my opinion. But I mean, everyone comes from different points of view, and everyone's here for different reasons. But I'm excited to hear about the amazing work. So the next section is going to be celebrating our Birmingham Food Legends. So the people that are going to be on the panel now are some exceptional people with some truly incredible work that they've been doing in the city, or the leadership that they've been showing in their community organisations and in their industry. And they're also breakthrough thinkers and innovators in the food system space. As Rosie mentioned, some of the people on the call would have worked with the Food Legends grant and accessed the Food Legends grant. Some of them drive the Food Legends, so they're the driving force that kind of help to platform the people of the city, or help to make sure that the city keeps running and keeps working for the people across here at the city. Some of them are quite new that we've only heard of, only spoken to recently, and we found out the incredible work they're doing and had to have them on the call today, and look forward to working with them more in the future. So what I'm going to do is quickly share my screen just so everybody gets to a quick view of the amazing speakers we have, and then I will then bring it back, stop sharing the screen, and each one of the speakers around the panel will have 10 minutes to talk about themselves, their organisation, and the importance of food legends and of people driving, communities driving the Birmingham food revolution and the food change. And then at the end, after everyone's had their 10 minutes and everyone's spoken, we will have the opportunity for a Q&A. We have a couple of questions that were pre-submitted, so we'll start with those, and then any that are in Q&As we'll share with the group. So as you can see all the names on the screen, but what I'll do is I'm going to stop sharing so we can see all the amazing faces. And our first speaker is going to be James. So James Lowbridge is the Foundation Operations Manager at the Aston Villa Foundation. James is a leading force behind the exceptional Aston Villa Foundation and the outstanding work that's been going on at the Villa Catering Club. So for those who don't know about the Villa Catering Club, it's a collaborative project with the Digbeth Dining Club, nationwide Caterers Association, and Southern City College. And for the last 3 years, it's helped over 50 people to gain real life experience, to get into catering, to start up their own businesses, and so much more. So, I mean, the Villa Foundation are kind of at the leading edge of ensuring a diverse population get into the food system, make the change to the food system, and keep driving it. And it's a great honour to have James here today to share some of that experience and some of the work they've been doing. So I will hand over to James.
Thanks, Bradley. Thanks for the kind introduction as well. I'll touch on the Catering Club programme. We've did it the last 3 years. We secured some funding from the Professional Football Association through the Premier League, which is a grant that we've been able to stretch over the 3 years. Working with Digbeth Dining Club, working with Southern City College, also working with Food Legends as well. We've been able to provide a bit of an opportunity and platform for those who are seeking employment or opportunities to work within the hospitality and catering industry. We work with Southern City College, as I mentioned, so we run 8-week cohorts here at Villa Park, working at the kitchens here at Villa Park. So hopefully people do see it as an opportunity to come to the stadium. It is in the heart of a lot of communities, a lot of highly populated communities as well, who are seeking employment. We work with Southern City College, who provides a tutor who tutors the level 2 in catering and hospitality. So they go through some theory work, but also have every day when they come here, they have a practical element of being in the kitchen and cooking a range of different healthy meals to provide that first-hand experience of being involved in a kitchen environment. Work closely with Digbeth, who's one of our partners within the program, who provide work placements and work experience and the expertise of their world in terms of street food, and we kind of support and facilitate candidates from our program who are all 19 years and above to take on that work experience placement with a view of then hopefully finding employment opportunities at the end of the 8 weeks. We have NCAS qualifications, online qualifications in food hygiene, and a range of different topics within the industry as well. So there's a little bit of home learning involved as well as face-to-face learning here at Villa Park. We're running 4 cohorts this year. We've just in the week 3 of the first cohort of this season, we have 12 every time. We have had a full quota, which is great, and a lot of people involved in the program are very, very close to residents close to Villa Park. So we're really pleased that we'll be able to give this program back to the local community on our doorstep. Off the back of the Catering Club program, we've worked with Digbeth very closely in formalising our own enterprise, which is going to start very, very soon, which will be our own catering van. Primarily we're working out of Digbeth, but more so going to different community events up and down the city, hopefully to help tackle food poverty. Also, obviously, its own kind of source of employment opportunities as well for those, whether that's coming from the Catering Club program and working on the catering van, or whether that's the wider public as well. So we're really excited that that's going to be something that will hopefully provide meals for our Villa Kitchen program. So we'll prepare the meals on the van, and it'll go out. The Villa Kitchen program has been running for multiple years as well. It's sourced from our own fundraising activities and small grants as well. We were able to get as a charity. But the money we do generate as a charity, we like to give out back to meaningful opportunities and activities, and Villa Kitchen is one of those. And we reprofiled that very recently to give back to and support organisations who are working with the most vulnerable young people in the city who maybe not having hot meals on a daily basis. So we're positioning that Villa Kitchen program now to support young people in the city more so. So it's one that we're really proud of, Villa Kitchen, and how it's evolved, and something that we're looking forward to continuing in the near future as well. We're actually raising money for the Villa Kitchen program this Friday, doing a sleep out here at Villa Park. So that's one of the fundraising activities that we do. We've worked with all other organisations around food poverty in the city recently as well. Islamic Relief is one of those. We across this year so far, I think 1,000 food parcels have gone out to different families and communities that have been identified through Islamic Relief. A lot of them within the doorstep of Villa Park. And leading towards Christmas time, we are doing a food drive as well for Aston and Neutral's Food Bank. So a lot of stuff to look after at the moment, and it keeps us busy, but it's very powerful and meaningful. So we're really proud to do it.
Thank you, James. And if you want to share some of the links into the chat as well, if you have anything that we want to get the audience to tap into or to help to support, please do. Okay. And I know you're sticking around for the questions at the end, but it's amazing to hear. We were talking about system players, and Sarah mentioned around sometimes we don't realise how much different organisations are involved, but most people probably wouldn't realise a football club would actually be one of the driving forces across Birmingham for a lot of kind of around our food economy, food skills, food security. So yeah, it's fantastic to hear kind of that wider aspect. So thank you very much. Okay, so we'll move on to our next panelist for them to introduce themselves. So our next panelist is Eric. So Eric Gang is a project coordinator at Cushinga Community Gardens. Eric recently spoke at our Black History Month conference around his work that he does in his community. And as soon as we heard his passion and we listened to the knowledge that he brought along to that session, we knew that we had to have him today on the call to be able to share his experiences. Eric is driven and is driven the inclusion and diversity of the growing environment in Birmingham, and showcases the power of breaking down barriers in bringing people from around the world together in a humble growing space to achieve breathtaking community togetherness. So kind of want to welcome Eric.
Thank you very much, Bradley. And hello to everyone. It's a pleasure to to join you all during this epic event, the launch of the Birmingham Food System Strategy. And as Bradley says, it was a great opportunity to have shared our experiences the last time we had that opportunity. And again, it's wonderful to say I'm part of Kushinga Community Garden is based at Birmingham, and we are a community of refugees, asylum seekers that have got together with local residents to be able to share our experiences of food growing. And I come from Cameroon, and I came to England to do a PhD, and I completed that PhD, and I'm part of the community at the moment. So Kushinga means, it's a Shona word, it's used in the southern part of Africa, and it means uh, building a thick skin, or resilience during times of crisis. And one of the things I do mention often is that when people migrate, when people move for different reasons, sometimes one of the things they carry along is seeds. You know, for me, when I was coming over to England to study, I had seeds from Cameroon, basically to come cook those seeds and eat. And then you have, in times of crisis, we've had stories where women actually hid seeds in their hair in order to travel with those seeds when they had to go through the deserts or through the seas. And again, when these people get to their host communities, they become an asset. But sometimes this asset is not valued in terms of the experiences of growing, the experiences of the food culture they bring along to enrich the context where they find themselves. And that's one of the reasons behind us coming together to form Kushinga Garden, which is a kind of a safe space where these people who come from diverse backgrounds and experiences bring their growing experiences on board, on how they grow food, how they process food, how they cook food, how food tastes in the different contexts, and that in a way enriches the food experience of the communities or their host communities. And interestingly, we are a grantee of the Birmingham Food Legend project, which has added significant value to some of the things we do in terms of bringing people to look at how can we grow food sustainably, that is ecologically friendly, culturally friendly, and accessible to those who are struggling, especially in times of crisis like this. And it's for us, it has been about empowerment to get these people to say, well, all is not lost. You've got something to contribute to the context where you find yourself. So we've had these people, uh, a sense of belonging, a sense of empowerment, a sense of knowledge that they are part of the community, and they can bring on board a significant contribution to what is happening where they find themselves. And we've been able to just challenge that whole notion that refugees or asylum seekers are not, from a cost benefit analysis which is done by the government, they could be part of this whole strategy of developing an inclusive policy that looks at the experiences these different people bring on board, not necessarily focusing on, or what's the cost to the economy of these people arriving in these different contexts, but their knowledge and experiences of growing food can actually enrich the context where they find themselves. And for us, having to grow healthy and nutritious food, of course, sometimes it could be the same food, it could be the same potato, the same spinach, the same tomatoes, but how those different foods are mixed and cooked in a different context could be different. And so these people have brought these experiences on board, and with local residents, we've together grown this food at Kushinga Garden, prepare this food, share this food, and the experiences have been overwhelming, have been enriching, and we've all actually gained from sharing these experiences. And for us, kind of advocating and saying, well, if Birmingham, opens up more inclusive spaces for people to bring on board their experiences, it could be a kind of an opportunity where we get to tap from these experiences that come from all over the world to be able to enrich our food culture in Birmingham. So that's what we've been doing at the level of Kushinga Garden, and bringing on board these diverse views that has enriched our experiences as residents of Birmingham. Thank you very much.
Brilliant. Thank you, Eric, and thank you for sharing that. And I think that the powerful kind of the image around the passage of seeds actually being that passage of culture, that passage of history, that passage of knowledge, not just for the communities that are making those journeys, but actually for the communities here in Birmingham to learn, to grow, and to be able to kind of create that shared experience that only I would say that a city like ours and how diverse we are, we could have. Thank you, Eric, and no doubt there'll be a lot of questions around Kasunga Gardens that'll be coming through from the audience. Okay, so our next speaker is Vicky. So Vicky Hemming is the head of food at the Active Wellbeing Society. Vicky is an absolute powerhouse in the community food space. And it's great to have her on board. Vicky was an amazing asset when we were doing our very first creative dinner and made sure that creative dinner was the incredible success it needed to be able to then have the rest that came afterwards and started it from a great point. So yeah, Vicky is the head of food at the Active Wellbeing Society, which delivered some amazing feats of kind of the impossible almost during COVID-19, during the cost of living crisis still to this day, around getting food to the most vulnerable, but also having food that's affordable, that's accessible, giving people opportunities and so much more. So it's great to have Vicky here, and I will hand over to Vicky.
Oh, thank you, Bradley. I feel completely buttered up now. So yeah, so my name's Vicky Hemming. I wear two hats actually. So I'm head of food at the Active Wellbeing Society, which I'll expand on, but I'm also co-director for Incredible Surplus. So starting with that one, Incredible Surplus is a Birmingham-based organisation that intercepts and redistributes over 20 tonnes a month of surplus food across the city to the people that need it most. We received public health funding, the Food Heroes funding, for a joint project between us and Bags of Taste. So that's a London-based organisation that delivers mentored home cooking courses. And we were able to offer this to many of the people that come to collect food from us, who are disadvantaged by poverty and ill health. And there was a really high engagement in these cooking courses. And it was actually one of the most successful pilots that Bags of Taste have run across the UK. They got amazing feedback saying that nearly 3/4 of participants were more confident to cook, especially cooking from scratch. They were able to save money, and they felt really empowered by it. So that was a fantastic initiative that we were able to offer in a partnership. And also, one thing that we do at Incredible Surplus is that we've got 8 growing sites across the city, and we also engage people that come to collect food to come and work with us on the growing site to help grow fresh food. It gives people purpose and connection and signposting to other services that they may need. So that's Incredible Surplus. And then my day job is at the Active Wellbeing Society, and for those of you that haven't heard of us, we're about supporting people's wellbeing in the more deprived areas across Birmingham. We've got lots of interventions that support people to move more, connect, find purpose again, and access nutritious meals. So food's a massive part of what we do. So how can you engage in anything if you're not eating enough or enough of the right stuff? So we try and work and co-create with communities as opposed to doing two. It's what we try and stick to. So in the food team, I'm backed by some amazing cooks, managers, coordinators, and volunteers to do everything we do. We've got 4 community cafes and a food truck where we turn surplus food into nutritious meals for over 2,000 people every month. And we try and celebrate the diversity that we have in the city. So, for example, our 2 fantastic cooks that have got background in Jamaican food are helping us to celebrate Black History Month across all our cafes this month. And I know that's going to go down really well because we've done it before and it's just something wonderful to celebrate. We also provide cooking skills across the city, and one of our most popular sessions this summer was some family cook-off sessions where families came and cooked together. So no screens, families enjoying time spent together and learning new skills. And we had some really nice testimonies from families, with one mother saying she loved to see how her daughter blossomed and learned some knife and life skills through the course. And we've also been funded by the council to run a slow cooker pilot. So this is about empowering communities. So we showed some community groups how we run our slow cooker sessions, where we bring one we've made earlier, then we demo how we put it together and share ingredient packs for people to take home, borrow a slow cooker from us and do the same at home. But what we did, we gave these groups the tools to run these sessions themselves and tailor them to their own communities. And we're just trying to work with communities to see what sort of cooking skills they want and co-create future courses together. It's definitely worth me mentioning the Food Justice Network in Birmingham, and this was born out of COVID. It's basically a growing network of over 200 multi-faith frontline charities and community groups who provide vital food support across the city, and more than just food support in many cases. We've got food banks, community cafes, pantries and low cost food options. And a member of my team who's fantastic, Flo, some of you might know her, she coordinates this. And there's a map available with over 300 places that offer food support to people across the city. And it's a wonderful resource. So, you know, if you're in Ladywood, it's Monday, you need to signpost somebody who needs food, you can map up and see what's available and open near them. And the Food Justice Network, it drives change in the immediate sense, but many groups also want to empower citizens and support them into positive change as well. I'd like to mention the two projects that we're funded by Public Health. It's two projects that should ultimately funnel more resources to the food justice members who are really struggling to keep up with demand for food at the moment. One of the projects is all about reviewing and maximising the availability of surplus food in the city. The aim of the project's ultimately to help plug the leak in the food system by enabling even more food to be diverted than is already from landfill onto people's plates via the Food Justice Network in particular. And then the second project is about connecting corporates, businesses with the projects in the Food Justice Network for the provision of resources, including money, but support might come in the form of a direct sponsorship of a project, or maybe a central donation of, say, fridges or food or money to buy food, so that we can then redistribute across the network. So some sort, and we're looking at collective buying power as well to help support groups. And groups need more food, so it's hoped that this corporate sponsorship project and the surplus project will help meet this need. And the FJN is ultimately a powerful united voice. It's a platform that can reach many people very quickly. We really want to continue to raise its profile. And equally, the Food Justice Network can influence the food system. And one really good example of that is working with the public health team, who consulted the network on how to spend some of the cost of living funding that was available last winter and also this winter to get maximum bang for their buck. So as well as direct food aid to buy more food, groups were consulted on what they needed to increase their firepower. So when I say that, I mean, you know, new ovens to build capacity in their network, maybe more hot boxes to transform more food to people. So this was a great example of being listened to and then taking action on what the communities and groups are feeding back. So empowering the network rather than starting from scratch. And then we want to encourage more communities to cook and eat together, make them more resilient, promoting active travel, sustainability and the circular economy and everything we do as well. And we're wanting to expand more on the communal cooking and dining aspect as well, bringing people together from all walks of life to share stories and skills. So that's me.
Brilliant, thank you, Vicky. And I've had the luxury of being able to eat at one of your community kitchens at the Toisley, at your headquarters, but also watching the FJN grow from strength to strength against kind of the sheer challenge that is trying to feed a city of 1.15 million people. And you took the challenge and made it happen yourself, Flo, and all of the FJN members.
Yeah.
And it was great to see you in the news recently on the Birmingham Mail with the actual, the map up in the Mail as well. So, I mean, do put it into the chat, or I mean, any of the food system teams. I know a few of the team are on. If they can put a link to the FJN on the chat, it's also in our Food Revolution pages as well. So do check it out.
Yeah.
Okay, thanks, Vicky. I will coming back in a moment for our questions, and I no doubt there'll be questions around all of the amazing work that you do. So. Our final speaker, final panel member before we go to the questions, is Dr. Afia Alvi. So Dr. Alvi is a GP, and she's also a regional lifestyle lead. So she's a GP at the Alpha Medical Practice, and in her own time, she does a lot of the work around how to embed lifestyle medicine and lifestyle approaches. So Afia is a busy GP working on the front line here in Birmingham. And Sarah recently linked me and Afia together, based on how much she blew Sarah away with her insight and unique approach to improving nutrition and healthy eating through the medium of faith. So I want to welcome Dr. Alvi to the room. Oh, I think you're still on mute.
Sorry. Thank you so much for inviting me. So my name's Afia. I am a GP in inner city Birmingham, and I'm a lifestyle medicine practitioner. I'm the regional lead for the British Society of Lifestyle Medicine and the founder of Ilm Clinic. So if I just talk you through my journey, I've been a GP now for 10 years, and I've been working in inner city Birmingham. And actually over those years, what I've really noticed is that people are getting, unfortunately, sicker. And it's really sad to see firsthand, first line. So we've got a higher incidence of chronic diseases. And what really strikes me is actually we're having younger patients with chronic diseases. So, we're having patients that are diagnosed with type 2 diabetes in their 30s, whereas this maybe 10 years ago, I was seeing more so in the 50s and 60s. And that has had so many knock-on effects. So if you're having diabetes at the age of 30, then you're likely that you'll develop complications quicker. So I'm seeing this every day, day in, day out. And after a while, you start to think, okay, what more can I do? And not only that, when I see a patient, I realise that actually there's so much more that can be done to help them. So conventional medicine's great. Of course, I'm a GP and that's what I practice. But there's so much surrounding the reasons why they've come in. A lot of it is to do with their lifestyle. So it could be that they're not sleeping very well. Could be that something's not quite in sync with, a problem at work that's affecting their mental health. So there's so much actually that is there from a behaviour, from a lifestyle point of view. So with both of these in mind, I started to get not a little bit frustrated that I wanted to help more. There was something more that needed to be done, and I came across lifestyle medicine. Now, for those of you who don't know much about lifestyle medicine, it's essentially an evidence-based discipline, and it aims to support patients to prevent, manage and reverse chronic diseases. And it does this through behavioural changes and skills and techniques to create and sustain lifestyle changes. There's 6 pillars of lifestyle medicine. So number 1, nutrition, why we're all here today, about healthy eating, sleep, physical activity, or we could call it movement, mental well-being, minimising harmful substances and risky behaviours, and healthy relationships and connections. So these are the 6 pillars of lifestyle medicine. And actually, I find they all go hand in hand. They're all important. For example, if you eat poorly, then you might not sleep very well. If you don't sleep very well, then you're likely to make poor choices for your foods. So they all go hand in hand. And I would say, actually, I think when it comes to nutrition, it's really important. Eating is probably, I would say, one of the most fundamental pillars. They're all important, but I do there is an emphasis on what we're actually fueling our bodies with. We need to put good into our bodies. We wouldn't put the wrong diesel into our car and overfill it. So we need to really look at what we're actually eating. So I've started to implement this in my own day-to-day practice. So I spend a lot of time speaking to my patients on a one-to-one basis about their food. And actually, I find that pretty much everything they come in for, we can end up speaking about their eating and a bit about their lifestyle, get a bit more out of them. And it's been amazing. Actually, just today at work, one of my patients, he, quite upset about 3 months ago when I saw his blood results, and he was diabetic, only at 35. And now, actually 3 months on, with purely diet intervention, he's no longer diabetic. And that I'll be phoning him later to celebrate, because that's just something that is really wonderful. And that's purely not any medication, purely through changes in his diet. And that's exactly what he did. And he was highly motivated. It was easy to kind of give him the right advice, and he went away and did it. And we've got some results for that. And the other thing that I do in practice is run some group sessions with my patients. So so especially with our diabetic patients. So, I don't know if you know much about kind of diabetes is on the rise, and actually, I don't know if we're doing very well in Birmingham with football, or I don't watch football, but I know that, and I don't know if we're winning or losing in football, but I'll tell you that we're winning in diabetes, which is a really sad statistic that we don't want for Birmingham. So that's why there's always a bit of an emphasis actually on helping patients with their diabetes. So we run some group sessions, which is beautiful. I think group sessions, the fact that they all speak to each other, they get some motivation of each other, I found that really helps. So moving aside from everything that I on a day-to-day basis, what I realised in my own learning journey was actually that behaviour is really driven by our beliefs. So if we can kind of look into behavioural change through our belief system, then maybe we can tackle it at a different angle. So I kind of took a deep dive into my own faith, which is Islam, and looked at what is in our religious texts and scriptures to kind of help us along. And so I coupled the information that I get from faith along with evidence-based science to actually formulate, a course. So we've run the course now. So this is all part of what I call ILM Clinic. So ILM stands for Islamic Lifestyle Medicine, but actually ILM in Arabic, the meaning of the word is knowledge. So what we're doing with ILM Clinic is actually just really, learning to live well. So that's the idea of ILM Clinic. And so we've run courses at community centres. When I say we, it's my husband and I. He's also a lifestyle medicine practitioner with a lifestyle medicine diploma. He's also got a special interest in diabetes, so and he's a GP. So we run these courses just in community centres, and we go through the 6 pillars. So not just nutrition, but we actually go through nutrition, sleep, connectedness, all the 6 pillars, and we put in the same evidence. So we talk about religion, but we also back it up with science. So simple things like this, verses in the Quran that tell us not to eat in excess. So then we'll talk about, the ways that we can try and implement this in our day-to-day life and how beneficial that would be for us. We also talk about the concept of, I think everybody's quite familiar with the term that we use is halal, but actually the actual verse doesn't just talk about halal, it talks about the concept of halal and tayyib. And tayyib is actually about actually eating food. So I kind of joke with everyone to say, well, we don't actually eat food. We shouldn't really eat anything that our great-grandmother doesn't recognise as food. And a lot of the time, I don't think my great-grandmother would recognise some of the foods that we ate today. So we talk about this concept of whole foods, pure foods, and the way we eat, really the idea is unprocessing your diet. So there's lots of simple messages that are running through the course, backed up with science that really help. And I think it's just different people are inclined to listen to different ways of teaching. So, if we have got some faith-based that want to learn it more in a religious way, that's absolutely fine. Some people won't like this method. However, the content is the same. It's the same healthy lifestyle advice. So we do a bit of science as well. So we go into carbohydrates, proteins, fats. We're quite We do like to, but in a fun and easy way for anyone to be able to understand. And we're very practical as well. So we won't just tell you what to eat or what not to eat a lot of the time. We'll give the alternatives, but also we'll show you maybe what to consider when you're going shopping. So I always tell everybody, if you know the way the supermarket's designed, so you'll understand that actually if you go around the outside, you're probably better off. So at the beginning, you probably think about your local supermarket, and you might realise that you've got the fresh meats, you've got maybe the fish, cheeses, the milks, all the fresh produce, fruits and vegetables around as you go around, and then you've got water that you can pick up at the end, and then you come out. Everything in the middle is your, ultra processed foods, which you want to avoid. So we're just very practical about the advice we give. We teach them how to read the food labels. Not everybody knows exactly what's healthy, what's not. So we're always giving alternatives. So if you don't like something, I think one thing that we have to remember is that one size doesn't fit all. So everybody is different. And that's absolutely fine. And it's beautiful that Birmingham is so diverse. And actually, even within our faith, there's so many different cultures, so many different types of ingredients, and we can learn from each other, we can grow. And that's actually a really special part of it. Again, food is important. We all enjoy eating. We just need to do it sensibly, and we need to have a little bit of responsibility as well. So in terms of we talk about how to cook, what to cook in. There's always questions about oils and fats, and so we tackle all of these things in a very interactive way. And I think the feedback's been great. So everybody's been really enjoyed the talks, and it's not just nutrition. So again, like I said, nutrition goes hand in hand with everything. So we talk about nutrition, we'll do something on sleep, we've got a course laid out for mental well-being, and it all goes hand in hand. There's lots of evidence at the moment that talks about our diets when it comes to mental illness and how we can actually eat better and feel better. So I think the fact that it's the change in focus has made it very impactful. It's really holistic, patient-centered, a real kind of tailored approach to managing people's health. And the last part that we actually do is that we do encourage everyone to do their own nutrition prescription. Really easy, something simple, like for instance, take out sugar. Somebody might really enjoy 2 sugars in their a day, so maybe just make it 1.5. In a couple of weeks, maybe just reduce down to 1. So just really, everybody's different. So just simple steps for everybody. Sometimes after going to certain talks, you feel really overwhelmed, like so much information, and you don't know what to do with it. And you get motivated maybe for a day or two, and after that, you pretty much forget. So we like to encourage everybody set essentially SMART goals. And write their own nutrition prescriptions so they've got something to go home with. And not only that, but they would be doing their own sleep prescription and all throughout the pillars, really. So I think the idea for me is that it's a positive, optimistic. We can really create change. There's loads of ways to do it, but everybody is unique. Not one size is going to fit all, but actually we can learn so much from each other. Thank you so much.
Thank you. And yeah, it's incredible to hear about the lifestyle medicine and that approach, because it ties in so closely to the wider what we do in our public health division as well. I mean, we have our mental health team, we've got the food team, the physical activity team, and none of us work on our own. We have to tie in, because if you're not sleeping properly, you're not going to control those cravings. You're going to reach for the easy, unhealthy options. If you're not moving enough, you're not going to want to eat those healthy foods, or make it more that whole project. And then the mental health connection to everything is so important, particularly to the wider aspects of food. So it's really exciting kind of to hear a medic on the front line kind of explore these options, since adding that to your approach and to your community, because I know you work in an incredibly busy community, because Alpha's in Sparkbrook.
So we're in Alum Rock. So
Alum Rock, yeah.
Highly deprived and inner city area.
Exceptional work, and thank you.
Thank you.
So that brings us to our panel discussion section, where everyone's getting a chance to answer some questions. So if there is any questions, do put them into the Q&As or into the chat. So Sarah is going to be helping me out with this section and driving the question, because Sarah is always amazing at getting the best from people. But the first question to the panel, and if the panel want to turn their cameras on or if they have them off, that's up to them. But the first question to the panel is one that we've sent and asked them to prepare for, which is, what makes a good food movement or a food revolution in communities? So from your points of view, in your areas and in your specialities, what do you think is the driving force that keeps people involved or gets more people involved? James?
Oh, yeah. So from our perspective, it's partnerships, like collaboration, working with other people who share similar goals and values, who want to support the movement, I guess, support food poverty in the city, or for example, that's from our point of view anyway. So having like-minded people who are pulling in the same direction is invaluable. So that without partnerships, we wouldn't do the work we do. So yeah, that's the answer from me, really.
Thank you. Oh,
Yeah, I'm happy to add something, and I think, yeah, I agree with the partnership comment, but also support from, say, governing bodies as well, people with the power to enable and unblock the barriers, really, whether it's funding or getting the right people in the room together.
Yeah, for me, it's about sustainability. It's about how environmentally friendly that food is produced and the practices behind all of that, and how it minimizes pollution, how it takes care of the environment. Food that is, of course, culturally sensitive, because we've got a diverse community. I mean, it brings together all these experiences and values and principles around food that would characterize a good food movement for me.
thank you.
Yeah, I think for me, it's making it very appropriate for different, the population. So we've got such a diverse population in Birmingham, making it culturally appropriate for everybody. So certain resources that I give my patients, they look at it and they're like, well, I don't really even recognise that as food. I don't make it like that. So I think we need to be inclusive and have lots of different ideas and resources to actually help people.
Brilliant. So partnerships, the empowerment from government and from authorities, sustainability, and making it appropriate for real people with their real experiences. And not to take the opportunity to steal all those ideas, but linking that to the Birmingham food system strategy, hopefully that is kind of demonstrates why those three principles matter so much: to collaborate, to equalise, to empower, and how we do that, how we ensure that happens across the system and we get others to do that with us. And then you got these projects that the 4 speakers are running, and you can see it in real time, in real practice, how that actually makes a difference to everyone's lives in the city, which is incredible. So is there any questions in the chat? Or if Sarah, if you've got any questions?
There's none in the chat at the moment. I think it'd be great to reflect on what opportunities there are. Somebody just asked in the chat, in fact, how did we evaluate? I think that's related to the grants that we've had. So we were very determined to make sure that any of the grants that we had, first of all, that the forms and the whole concept of what the grant was about was co-produced. Then we tested the forms with lots of different people to make sure that people weren't tied up writing lots of like extra policies and whistleblowing policies and all these different things that can really hold back people from being able to access funding. So we made sure that we made those as straightforward as possible and focused on the core process of what was involved with these projects, and then made sure that we had a panel of people from the city deciding on who received that funding as well. So we had somebody from the Food Justice Network, and we had people from food system researchers who know about the evidence and best practice of what's really effective in our city. But we'd be happy to share more about that at another time as well. But essentially we designed our decision making around the principles that guide our strategy, and to make sure that we were empowering people to be able to achieve what they knew they needed in their own communities. And I'm glad that we've been able to be joined by some people today as well.
Thank you. Just out of interest, actually, while we're waiting for people to ask some questions, to the speakers, to the panel, Is there anything that you've heard from each other today? Because I know for some of you, it'll be the first time you've heard about that work stream or what's going on, or you might have heard about it but not been able to hear it in such detail. So is there anything from the other panelists that you'd like to know more about, or how it connects into the work that you're doing?
I love the idea of Kushinga and the fact that they grow together. I think community and connection is really important, and actually one of the biggest problems that we're facing at the moment is loneliness, and actually just to get everybody together to grow, you're doing something really wonderful there. So I thought that's a really good idea.
Oh, James?
Yeah, it's something I might follow up with an email to Eric. Yeah, we're starting a young people's program called Seed to Feed, growing food and stuff like that. So in primary schools, but also working with refugees and asylum seekers. We've about to start a new program, so it'd be great to kind of liaise with Eric about a few different things, really. So I will pop you an email, Eric. I've got your email. So yeah.
Yeah, thanks, Jim, and thanks, Alvi. Again, it's interesting to hear the connection between food and sports, which is something I never thought about or heard much about, and it was good to see how you're building connections around that and around the colleges, and which is quite a good niche area to focus on when we have the whole issue of young people and sports, and trying to get rid of, the whole issue of food-related diseases, obesity and diabetes, and how we can get these people active around what they eat, and of course tapping into Alvi's whole linkage between the religious part of it, the cultural part of it, and how that sits well within the whole issue of making food healthy, sustainable, and ethical. I would say. Thanks very much.
Brilliant, thank you. So I mean, hopefully that's a new partnership starting up there, and also link us in at the food system team. We're here to help, to link, to connect, to add whatever we can, and grow these partnerships that are going on. So I don't see any other question. There is a question in the moment at the chat from Ross. So Ross, just so you know, we'll be coming to that in the house section, which will be talking around the evaluation and next steps. So I'm going to leave your question in the Q&As for now, and we'll get to that towards the end of the conference. Well, conference of this event today as part of the conference. So we'll get to that. Okay.
Rosie's asked a question from our team as well, and she said, what's one action or next step that would improve the food system from your perspective? It would be great to hear from each of you about that. I'm going to go with Eric because he's got his hand up. So Eric, what one next step do you think we need to take? Sorry,
I didn't put that hand down when I raised it up the last time. Anyway, I'd go for it. I think it's still more of inclusivity. I would say. One of the things we do at Kushinga Garden is to create that safe space where people can get together, not only around food, but to share, other experiences. And food is universal; it brings them together. But besides food, we have all these other issues people are grappling with, and food is used as a conduit. So it's more of promoting those safe spaces, creating more safe spaces in Birmingham, where people can get together, around the whole issue of food, but have other things to discuss that contributes to the whole food system, which is it's a system. So it's not only about the food consumed, but all other things attached around food, I would say. Thank you.
Brilliant. Thanks. Thanks, Eric. Vicky?
Yeah, it's slightly linked to what you were saying, Eric. More communal cooking and dining spaces, really. Open up kitchens that aren't being used, all in a bid to help reduce social isolation and build those cooking skills and increase access to good food. And maybe not just increase access to good cooked food, but maybe have community food hubs or co-ops where people can, access fresh food to cook with. But just linking to the surplus food sourcing project, incentivizing businesses with tax breaks for donating surplus food would be amazing as well. There's still a stigma a little bit with some businesses in admitting how much might be wasted, but you know, that incentive could help.
Thanks, Vicky. Afia?
Yeah, so I think it's important, obviously, to increase access to good food, but then we have to think about the opposite and stop the access to bad food. I mean, I can honestly say if I walked outside now onto the high street, there is nothing I can eat that's healthy. You know, there's takeaway shops all down the road, you know, dessert shops, everything, and we know it's all bad for our health. And it's really hard if you're not disciplined or you don't have the knowledge to understand that that's not good for you. You will be eating it. So actually, we need to look at maybe we don't need so many, where we are, you know, if anything, we're kind of coming towards an overfed and an undernourished society. So I think that for me is really important. I think we need less bad food as well as better good food.
Thank you, Afia. James, what about from your perspective?
Yeah, I guess it touches on everyone's point a little bit, but for our point of view, it actually be obviously how we use our reach to educate, I guess. So we're a bit of a recognisable brand in the city. We're in a lot of schools. We do a lot of health-related programs. So it's how can we carry on educating young people, the new generation coming through, I guess, to eat more healthily, and with the other programs that we do have, especially our Villa Kitchen program, how do we provide that access to those healthy meals and healthy food to those who need it the most? So yeah, it's how we can continually increase our reach in the right areas, really. So I guess that's one action I'd take away.
Brilliant, thank you. I think all of those ideas align so much with other things we've heard across the city as well. Another thing that would be great to know is, do you know of any projects across the country that we can be learning from and building on with our approach in the city? It would be great to have knowledge exchanges with projects so that we're not having to create things from scratch. There's so much amazing things happening. So what other things have you heard of that could inspire us with our action in Birmingham? Vicky?
To do with surplus food again, but I connected with City Harvest, who are a surplus food organisation in London. They're bigger than Incredible Surplus, and we had a session to share best practice and talk of having a network nationally where groups from all cities connect and share best practice. And we're going to be meeting again to see what we can do together to improve the redistribution of food in Birmingham as well.
Brilliant. And we also connected with somebody else in their team about how you can engage with universities and students and having opportunities for people to develop new skills and have opportunities to experience work whilst supporting a project such as that. So it's great that there's so many parallels within these projects.
Definitely. Yeah, thanks.
Anybody else want to go next with a project that they're aware of?
Well, we've collaborated with Food Adventure. It's based in Wales within the framework of a project that was supported by my food community in England. And again, we actually shared them the whole experience of what we were doing in Pushinga Community Garden, and they started a whole movement like that in Wales, Cardiff. Sorry, it's Cardiff exactly. And so we've had the chance to go over there and see what they are doing, and they've had the chance to come over to Birmingham to see what we are doing. And again, the last time we had a presentation, we heard about the Handsworth Schools Association, and we exploring opportunities to collaborate with them because they've got an interesting project around carbon capture, keeping carbon in the soil, contributing to climate change in the process of food cultivation, which inbuilt in that whole food system we are talking about. So when we're talking about the food system, it's not only the food, but how is the grain of that food contributing to protecting our environment and ensuring that people are healthy. So we've got all these linkages we're building with other things that are happening in Birmingham to scale up what we are doing.
Brilliant, thank you, Eric. And the Handsworth Association from the schools have got lots of really great projects as well in their community. James or Afia, have you got anything to contribute?
not so much a specific project, but I guess people we've worked with in the past. Fair Share have always been really great. Obviously, a lot of surplus foods from different stores and chains. So we've worked with them with supplying food in some of our projects in the past. And there's an organisation more nationally called His Church. They're really good at distributing food nationally. A lot of surplus foods from big supermarket chains. And they looking for different projects to support all the time. So we've worked with them quite closely in the past, and it's been something well worthwhile for us to link in. So yeah, in terms of specific projects, nothing really springs to mind in my head, or my memory's quite bad. But the two big organisations we worked with in the past have been really useful for distribution of surplus food.
Thanks, James. And I think especially in the area of surplus food, where you get huge amounts of gluts and then nothing, and then you suddenly have like a ton of cabbage or something like that, cooperated working is absolutely essential to be able to manage that sort of variability. So it's really good so many people are working in that space and that they're connected. Afia, have you got any other projects that you'd like to reflect on?
Yeah, I think as part of British Society of Lifestyle Medicine, there's lots of learning from lots of other regions as to what they're doing in the city. So it's good to connect every so often with them and to find out what they're doing. So that's something for me to now go ahead and do some more of, I think.
Brilliant. Thanks, Afia. There's lots of local food legends case studies that we're capturing at the moment, and there's a few in the chat that people have mentioned here. So Vanessa Kelly from Too Much Passion has shared a little bit about their mobile cooking school that they've got, and they deliver culturally diverse and healthy meals, and it's about teaching young people how to cook more healthily, and it would be great if she'd like to connect into these projects as well. Alex has shared about a project in Coventry about the Pod Cafe, and it'd be fantastic if we can connect our regional approaches there. There's some really great work in Coventry. We connect with them quite a lot. So yeah, there's a lot we can learn from each other. Pam has shared she's part of a holidays activities and food program, and she's and street games as well. And she's talking about there's a program to increase education with young leaders in the city around the perception of food, as well as their role in respect and social responsibility by role modelling. And I think there's a whole lot that can be done there, and especially with the young people projects that James mentioned and other ones as well. And now there's a longer post that I haven't had the chance to read yet, so I don't know if Bradley has wants to come in there.
No, I haven't read the longer one yet, but I'm just want to say kind of thank you for all of those I've been putting into the chat. So, I mean, we are going to be going away and collecting all this information and sharing it and documenting it. And I also want to say thank you to our panelists as well. So thank you to all of you for coming along, sharing your projects, for doing the work that you're doing in the city and making such a world of difference every single day. A lot of the time, you know, much beyond what your actual job is or what you're being paid to do, you're making this difference as a volunteer, going above and beyond what you're doing in your actual role, and just committed to this city and to the 1 million+ people here, because the knock-on effect and the drive that you'll have is incredibly important. So thank you. Do put your contact information, well, not your personal contact information, but your organisation's contact information into the chat so people can get in touch, and your projects as well. Do please put them into the chat and share them with us, so we'll be able to share them wider when we come to share the videos and whatnot. So yeah, thank you very much to all of you. Do keep putting your chats in the Q&As and into the chat box. Where after the panel, we'll collect all these together, and if there is anything specific to either James, Afia, Vicky, or Eric, we will get them out to them for them to be able to respond to or to note down. So hopefully that was exciting. I mean, I found that incredibly exciting and insightful to hear about all of this amazing Birmingham food legends in this city. What we're going to do now is go for lunch, because you can't have a food event without lunch. And if we were doing this in person, we'd have amazing food, but instead you're going to have to go find your own amazing, nutritious, sustainable food where you are. So we're going to go away for 30 minutes. So we'll be back for 1:45, and we'll be coming back to the How Can We Make the Food System Fit for the Future panel. And on this panel, we've got some city policymakers and strategic leaders and thinkers from universities, from kind of leaderboards and from national organisations. So you don't want to miss that session. Definitely have your questions ready for the group. And then after that, we'll be going to the how, which is focusing back in on the strategy and how we're going to deliver it up until 2030 and long into the future. So enjoy your lunch. Make sure to get some exercise in there as well. But of course, it always matters about the food. We're going to say that. And we'll see you back here for 1:45. Thanks, everyone.
Thanks all.
Thank you.
Thank you.